symptoms of depression and critique the research on effective treatments for depression. What is depression? Depression is a serious, sometimes chronic, and too often terminal psychical illness that clouds the minds of sufferers, robs them of joy and peace, wreaks havoc with appetites and sleep patterns. This was the definition by Ainsworth Patricia in 2000s. Many people would describe depression as a constant feeling of sadness and a loss of interest in things that usually would interest someone. Normally, it does not occur from a single event, rather, it is a mixture of different factors and events. How is depression diagnosed? There are two main official classification manuals that are used highly by both the United Kingdom and the United States of America. The ICD-10, which stands for International Classification of Disease, 10th revision, and the DSM-5, which stands for Diagnostic and Statistical Manual of Mental Disorder. The definition of depression is essentially syndromal and medical, resembling that of a syndrome in other fields of medicine. This implies a cluster of symptoms and signs which tend to occur together. This was a quote by Eugene S. Paykel in 2008. What are symptoms of depression? According to the DSM-5 diagnosis, the criteria for depression is depressed low mood, loss of interest or pleasure, weight loss or weight gain, insomnia or hypersomnia, fatigue, decreased concentration, thoughts of death and or suicide. According to the ICD-10 diagnosis, the criteria consists of persistent sadness or low mood, loss of interest or pleasure, fatigue, low energy, disturbed sleep, low self-confidence, guilt or self-blame, agitation or slowing of movements, poor or increased appetite, poor concentration or indecisiveness, suicidal thoughts or acts. What are some myths about depression? In this slide, we will go through some of the myths about depression and reveal the truth behind them. Depression is all in your head. This is false. Depression is a psychological, social, and biological disorder. It is chronic and takes different treatments to be able to manage it. Number 2. Depression can only be treated with medication. This is false. Medication is one of the main types of treatment, but not the only one. CBT, which stands for Cognitive Behavioral Therapy, is effective with people who suffer of depression and can be recommended whilst on antidepressant. Number 3. Depression is the same for all people. This is false. Every individual experiences depression differently. These differences can be based on hormonal changes, changes in the brain, and psychical events. There is no size-fits-all experience for depression. Here are two statistical charts showing research by Aaron T. Beck in 2008. The top chart shows collected data from a longitudinal study over the period of 12 months, showing the prevalence and severity of mood disorders. Below it, we have the statistical chart showing the ages at selected percentiles on standardized ages of onset distributions of DSM-5 mood disorders, with projected lifetime risk at age 75 years. What are some treatments of depression? Number 1. Antidepressants. These are medicines that treat symptoms for depression. An example of this would be SSRIs. Number 2. Brain stimulation. Although not a popular treatment, it is used to treat severe depression that has not responded well in the past with other treatments. These treatments can include transcranial direct current stimulation, electroconclusive therapy, and vagus nerve stimulation. Number 3. Combination therapy. While taking antidepressants, doctors recommend talking therapy alongside with the treatment, such as psychodynamic psychotherapy, counseling, or CBT, which aims to understand your thoughts and behavior. They can usually happen once or every 2 weeks. Antidepressants as a treatment for depression. Optimal treatment starts with appropriate patient education about the nature of the illness and the nature of the proposed treatment. The choice of antidepressant drug is based on the type of symptomology as well as severity of symptoms, avoidance of side effects such as sedation, weight gain, and sexual dysfunction. It has been suggested that SSRIs, which stands for selective serotonin reuptake inhibitor, are more effective than primarily noradrenergic, excuse my pronunciation, antidepressants in reducing irritability, aggression, and anxious symptoms. Strengths of antidepressant medication. They relieve the symptoms of severe depression, such as feeling down or exhausted. They are meant to make the patient emotionally stable again, make the patient able to follow their normal daily routine. They can increase your energy and motivation levels, can cause a sense of increased overall mood stability, overcome overwhelming situations in their day-to-day life activities. A study in 2006 researching the side effects of antidepressants stated, there is no perfect antidepressant that works quickly and is completely free of adverse reactions. Newer antidepressants are safer, better tolerated, and associated with a lower rate of non-compliance. Critiques and limitations of drug treatments. Side effects of antidepressants include decreased alertness, headaches, nausea, sexual dysfunction and problems, tooth decay and bad oral health, diabetes, and gastrointestinal bleeding. Here I have provided a statistical chart showing the prevalence of symptoms in patients taking antidepressants. These statistics are from a research done in 2013 called Side Effects of Antidepressants During Long-Term Use in a Naturalistic Setting. There are some people who suffer from other conditions who cannot take antidepressants. These people can be suffering from type 1 or type 2 diabetes, epilepsy, serious kidney or liver, and heart problems. Symptoms that you may have after withdrawal of antidepressants are flu-like symptoms, anxiety, dizziness, vivid dreams at night, sensations in the body that feel like electric shocks. These symptoms after withdrawal can last up to 2 weeks. These are the references used in the presentation. Thank you for listening.